Improving care for Black patients. We've recently told you how African Americans respond differently to medication than people of different races taking the same medication. Well, now a local professor has research to explain why. News 5's Olivia Fecto breaks it all down.
These days, Reverend Dogba Bass is the pastor at Aldersgate United Methodist Church in Warrensville Heights. But 10 years ago, he was diagnosed with prostate cancer, the same disease that killed his uncle.
I was diagnosed in 2010. Then we kind of figured, wow, this must be in our family.
Bass says his brother had prostate cancer too. Both men recovered after having their prostates removed.
By God's grace, I didn't need to do any radiation or any chemotherapy.
Rates of prostate cancer are higher among African American men than white men. We've known that for years. But new artificial intelligence research from a professor here at Case Western Reserve University shows differences on the cellular level between Black patients and white patients. And that could help tailor medical treatment that works for people of different races.
We've always tended to look at the tumor. We've always thought that that's where the money is.
Anat Matabushi is a biomedical engineering professor at Case.
And what you see here inked up is the tumor.
He says using artificial intelligence, they looked at slides of cell tissue outside the tumor.
The appearance of the disease is actually different between Black men and white men.
For most men, prostate removal gets rid of the cancer, but for about 20%, that may not work.
Might have metastasis, might have spread of the disease.
Matabushi says this research could help figure out who might see a recurrence of prostate cancer or whose cancer might be more aggressive.
This is really changing the rubric, the paradigm that has been sort of the status quo thus far.
While AI isn't perfect, Matabushi says it's a tool scientists can use to help people get better treatment tailored to them. And when it comes to treatment for cancer, Reverend Bass knows it's not always simple.
We need to do better. We need to try a little harder because one size doesn't fit all.
Olivia Fecto, News 5.